Go. Good afternoon, everyone. Thank you for joining today's webinar entitled Evidence-Based Practices in Tribal Communities, Challenges and Solutions. This webinar has been sponsored by the Bureau of Justice Assistance and Council of State Governments Justice Center. We are excited today to be joined by Dr. Anthony J. Ernst. Dr. Ernst has more than 25 years' experience in the field of substance abuse and mental health prevention and treatment as a clinician, academic, and project director. Throughout his career, he has led strategic planning, product and policy development, and training. He has also led systems change initiatives that help mental health and substance abuse service providers promote collaboration and build service capacity in support of diverse populations. It's a pleasure to have Dr. Ernst join us today. It's all yours.
Cynthia, and thank you to the Justice Center for inviting me here. This is a very important topic, and I appreciate the opportunity to have that discussion today. I also want to acknowledge the many people that have been addressing this topic for many years. They include Caroline Cruz, Cindy Arbor, both from Oregon, Echo Hawk, Dr. Walker, Dr. John Ovens, and many others. I want to acknowledge all of their efforts and their work can be accessed from information that I have on my resource slide at the end of today's presentation. Much work also will be represented in my discussions and on my slides. Why is the topic today? Well, evidence-based practice requirements continue to gain momentum. More and more funding is directed to practices that are based on research findings. Based practices are seen by more likely to result in desired client outcomes across various sets and geographic locations. Although I'll talk about the various components of evidence-based practice later in this presentation, in general, evidence-based practice combines several sources of evidence, reads the effectiveness of the intervention, content experts that bring their experience to the formula, and within the context that ensures the intervention fits the target population. Combining these three different ways of knowing is challenging. The last component, the cultural component, may be challenging. A limited number of evidence-based practices that are culturally sensitive to the national population. Why is evidence-based practice of movement challenging for tribal communities? Notice that I've listed the increasing reliance on evidence-based practices leaves Indigenous communities as a huge disadvantage. Indigenous populations have had relatively little research in the best practices from funding agencies in comparison to the general population. There's relatively little attention to ethnic and cultural research and literature. As a result, tribal communities have a very limited number of evidence-based interventions to select from. They've been tested for their efficacy and effectiveness in tribal communities. The majority of behavioral health evidence-based practices are designed for conventional mainstream American populations. The fact of evidence-based practices for this population is in the service delivery systems, where treatment options and cultural components. Dr. Thatcher referred to this service limitation in 1999 in the Surgeon General's report. It says, even more than other areas of health and medicine, the mental field is plagued by disparities in the availability and access to services through the lens of racial and cultural diversity. The disparities that Dr. Thatcher refers to in this quotation still exist today. A little background. What is this evidence-based practice? Why is there so much pressure for evidence-based practices. We know, we know that Indigenous communities have embraced science within the context of principles, laws, and values regarding the effectiveness of local practices. Science within tribal communities was necessary for tribal communities to survive for hundreds of years and to improve conditions over time. Much of the resiliency in tribal communities that we see today is to the effectiveness of local science and a reconnection to the tribal wisdom passed down over time. The experts in local communities are often tribal elders. The spiritual, cultural, intellectual wisdom of that community. Their behavior and wisdom are widely recognized in the community as valuable and basic teachings. The teachings provide the basis for understanding what works and why in that community. These teachings have been the basis for healthy tribal communities for centuries. If it's on the broad national push for evidence-based practices in behavioral health practice, long-term genuine concern regarding workforce competencies and standards of practice. One of the strongest influences in the evidence-based practice movement is a report by the Institute of Medicine called Crossing the Quality Chasm, a new system for the 21st century. It was in March of 2001. The result for fundamental change to close the quality gap between science and practice, and among many other recommendations, it suggested key steps to provide evidence-based practice. Today, evidence-based practice are universally required in behavioral health settings. For discussion, further into the definition of evidence-based practice and the changes and solutions that tribal communities face. This definition is very basic. How is the relationship between practice and findings? Evidence practices consist of interventions, services, and supports consistently shown positive outcomes through research. This shows the multiple pathways of knowledge that support evidence-based practices, including expertise of the individuals providing the intervention, expertise of the developers who developed the particular intervention, research in terms of outcomes, the study of the outcomes, and the evaluation of the repetition of outcomes, multiple streams of evidence, in what we know, current knowledge, what we know about the particular target population, and pulling all of the evidence in terms of research possible for this particular intervention. And multiple streams come from multiple systems. Again, multiple pathways of knowledge for a common purpose. This come from NIDA's clinical trials, the Institute of Health, Institute of Medicine's, many of the papers and documents and other material coming from that. All to increase our knowledge and skill in a particular area. Particular challenge in tribal communities deals with data. Good data drives decisions. Gathering data can be difficult, expensive, and time-consuming. However, framework of science, data consists of what can be observed and counted. However, within the context of many indigenous cultures, they're the seen world, but seen world as well. Things are out of harmony in the unseen world. This disharmony is reflected in the seen world. Only in areas that can be seen. Collecting data only on those measures in a linear approach is insufficient to create change from the perspective of the traditional indigenous teaching. It's more holistic, circular in approach. Gathering data is a significant challenge for tribal communities. Access to data collection, data analysis are particularly challenging for many Native communities. Recently, under the control of outsiders, may conflict with the community on which topic to address, on the action to take, how it can regulate research among the tribal members, and what research may be viewed as harmful by the tribal community. Feelings of mistrust, fear of exploitation from the research community, and negative attitudes towards evidence-based practices are not uncommon in tribal communities. This slide provides a visual of the layers of evidence, including research and scholarship, cultures, clinical experience, and the cumulative challenges of establishing a gold standard of evidence represented at the top of the pyramid. In a flow chart, you can see a strong relationship between the same factors: scholarship, client factors, clinical experience, and feedback from practitioners, the clients, and other systems that implement the practice. When effectively following the improvement process, we have ideally improving client outcomes. The chart in front of you can be rendered as the life of an evidence-based practice, and the ability of that practice through a feedback mechanism over time. We end up with improved client outcomes as represented in this quality improvement. Think of evidence-based practice, performance measurement, and improvement, suggesting that feedback mechanism is in place. It's all improve based on new knowledge, whether it comes from the clients, from a particular or clinical trials. It's all improvement over time. This relationship between all three of these that make up the client improvement. In tribal communities, the process is demonstrated in several ways, such as through talking circles that bring community members together to equal practices and performance. Of evidence-based practices provides an opportunity to create a bridge of understanding among staff in an agency or among community members. This process allows members to do two things: define a set of criteria that creates what works in that agency or community. For the definition of the management system, it allows for identification of the accountability system that demonstrates the effectiveness of the program. It allows for a pulling together of resources and evaluation of those capacities to improve client outcomes. After criteria has been selected and the other components are in place in terms of evaluation capacity, in terms of resources available, and in terms of the match between the evidence-based practice and the needs of a particular agency or community, they begin to take a look at the fit between those two. Here is a representation, attempt to find evidence-based practices to address behavioral disorders. Here we have parent management training and CBT, cognitive behavioral therapy, for action. There's some overlap. If we were to fill in more color in this pie chart, what we find is that CBT does a lot more to address self-harm issues and delinquency issues. Find that parent management also does more. The challenge is selecting evidence-based practices is to make sure that there's a good fit between resources and objectives. These are some suggested guiding principles that are used during the selection of evidence-based practices. Is to build on the principle of relevance. Guidance should be relevant and meaningful to the members of the targeted group. Here, in the education, the target population be at the forefront of consideration in an evidence-based practice. The first implication is that target population and cultural factors unique to that population to be considered with the development of evidence-based practice. Principle of participation. The community should serve as active participants in the implementation of the program intended to benefit its people. It really needs to be embraced by others who are going to be responsible for not only its intervention, but for the sustainability of that particular intervention. Operations between other than the selection of evidence-based practices are identified on this slide. Training is a huge consideration. Not only are you looking at your own capacity to provide training on the intervention to providers who will be implementing that intervention, but you have to also train the supervisor who's going to be responsible for supervising others regarding the intervention. You're going to have to consider sustainability and train the trainers so that over time the intervention will continue to be applied with fidelity or with adaptations that were selected. You'll also have to make sure that there's some consideration for time and resources. This process can be lengthy depending on the number of participants involved. The resources necessary will individualize depending on the cost of the intervention, the number of people required to provide the intervention, and the length of time before the outcome is attained. Today's presentation, I spoke about a number of evidence-based practices that are culturally sensitive and applicable to tribal populations. Fidelity is also an issue for tribal communities. Just the degree of implementation of the practice. It's whether programs with high fidelity have to have greater effectiveness in the application and achieving desired outcomes. Is whether or not an intervention after selected be applied with any adaptations to meet cultural needs of a particular population. Adaptations be made for the purpose of enhancing the intervention's effectiveness without eroding the intervention. Should it be implemented with fidelity, with regard to the uniqueness of a particular culture. Contrast, adaptations be made in the field to accommodate the real and unique needs and realities occurring in a particular community. These questions be addressed direction of evidence-based practices. So sociocultural factors are larger scale forces within societies that affect thoughts, feelings, and behaviors of the individuals. They include practices, ethnic values, family structure, regional differences, and the challenge of limited evidence-based practices regarding cultural considerations. Indigenous communities are faced with having to select an evidence-based practice that is rooted in native social and cultural context with effectiveness for their community. Although cultural competence in many fields has had some influence in mainstream research with increasing cultural requirements for evidence-based practice, the number of culturally sensitive evidence-based practices remain low. the use of Mental Health Services Administration. This particular issue recently hold a conference for Native American program developers and evaluators in order to support the development of Native evidence practices to increase submissions of those interventions to assess online registry of based programs and practices. Registry of evidence-based programs and practices. Searchable online registry of more than 250 interventions. Support one of 4 areas: mental promotion, substance abuse prevention, mental health, and substance abuse treatment. The NREP website provides access to intervention developers so the public can learn how to implement these approaches in their communities. NREP is not an exhaustive list of interventions. It houses all of the available interventions, nor does it include instrument regarding the effectiveness of the intervention. What stands out about the conference that was held recently, American developers and evaluators, was that it was a first-time event, and it took to build on the principle of relevance, that should be relevant and meaningful to members of the targeted population. The conference also welcomed an open discussion of the question, how we establish partnerships, design evidence-based interventions that are culturally relevant and have maximum effectiveness